This conference will now be recorded.
I would like to call the February 1st meeting of the North Country REMSCO to order. It is 1900 and we're going to begin with the Pledge of Allegiance. If you would follow along and please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. The minutes from the prior meeting were sent out. Are there any additions, corrections, or changes? If you have anything, either put it in chat or unmute and let us know. Hearing none, do I have a motion to accept the treasurer's report as provided? Or I'm sorry, the minutes as provided.
I'll make a motion.
Dave Sherman made the motion. Do we have a second, please?
Bruce Wright will second.
Bruce Wright seconded it. I'm going to give it a minute. If I don't hear any objections, then we're going to assume that the minutes are accepted as presented. Anybody have any reason not to approve the minutes?
There is nothing in the chat, Debbie.
Awesome. We're going to go ahead and keep moving then. Next thing is the treasurer's report. So you will see that it was sent out as of January 21st. And obviously there's not a lot of money in there because we're not spending any money. We're not able to do any of our events. I will tell you that we did pay Dr. Delaney her stipend that came out at the beginning of January. And that's where that total assets is now at $14,410.55. Jonathan continues to reconcile the account every month and forward it to me for review. And as I stated, there's not much coming out of it. You know, we had some CON things where we had to overnight some things and Dr. Delaney's money, but we just don't have the events going on where we're spending it. Obviously, we don't have any mileage reimbursement because we're not meeting in person. And on that note, just so you're aware, they have lowered the rate for this year down to 0.56 cents a loaded mile. So maybe we'll be able to get together soon, but right now we're not expending any of those funds. Could I have a motion to accept the treasurer's report, please?
I'll make that motion.
Motion made by Ron Smith. Could I have a second, please?
James Barr will second.
Thank you, Jim. Seconded by James Barr. Moving on, we'll go to the enforcement list.
Debbie, could I just add something in quick?
Absolutely.
I also think it's important for the membership to note that we are not seeing any incoming funds to that either because there is no approved contract and there have been no payments made. And that is for both program agency and REMSCO.
And ours has been sent back to us again, as happened to the program agency with Ann. It was current at the time it was submitted, and now it's not because things have expired, and they will not accept that we have filed our charitable contribution. I even sent a copy of where it went in, and they will not accept that. They want the letter from the charitable contribution saying that it is received and that we're in good standing. And they are about 7 months behind because of COVID. And I've talked with a couple people and they were going to see if they could find ours and get it processed. So it's just a vicious cycle. So I'm afraid when I get that fixed, something else is then going to have expired again type deal. So working on it, hopefully we can get that resolved. Enforcement list, we have a pile of them. First one's from November 17th. Brian McIntyre in Long Beach, New York, surrendered effective 11/3/20 for violations of 10 NYCRR Part 800.16A8. December 15th, 2020, Hartfield Volunteer Fire Company in Mayville, New York. Suspended for 1 year effective 12/8/20. The suspension is stayed pending no new violations for 2 years. Assessed a civil penalty of $2,000 for violations of Public Health Law Article 30, 3012D, Public Health Law Article 30, 3006, and 10 NYCRR Part 800.15. December 29th, 2020, Christopher Foy, suspended for 1 year effective 12/18/20. The suspension is stayed pending no further violations for 3 years. Assessed a civil penalty of $2,000 for violations of 10 NYCRR Part 800.15A 1 and 2 and 800.3 AP 2. January 28th, 2021. Furs Bartov of Staten Island surrendered effective 1/17/21 for violations of 10 NYCRR Part 800.16A10. Last one, January 19th, 2021, Newark Arcadia Volunteer Ambulance in Newark, New York, suspended for 1 year effective 12/22/20. The suspension is stayed pending a full service inspection and no further violations for 3 years. Assessed a civil penalty of $5,000 for violations of 10 NYCRR Part 800.21B and G, 800.23A, D, E, and F, 800.5D and 3, 800.24 C4 2, C4 3, E 1 through 6, 800.24 F15, F4, H11, H5, H7, H8, and Public Health Law Article 30, 3012, 1B. So those are the enforcement lists that we've received so far. Is there any other correspondence? And I know you have some, but I assume it's going to be in your program agency report.
Yeah, I think that we're more pertinent to the remap.
Okay. Barring no other correspondence, we'll go on to committee reports. Air Medical, Mark Tuttle.
Sorry for the delay. Can you hear me okay?
Yep.
Okay. I really don't have much on the air medical side. The annual reports were circulated. I know they were kind of large documents, and if you wanted to look at the fine detail, you had to correspond individually with Ann, and I apologize for that. But I know Colleen is on the call, Matt is on the call, but I really don't have anything to report specifically, other than both Mercy Flight and LifeNet of New York are providing virtual conferences. I know ours is coming up, I believe, March 10th. You can be looking for that, and we'll push that to Ann to get out when that's available. Thank you.
Matt or Colleen, anything you would like to add?
Nothing, just echoing that the reports are out there. If anybody has any questions regarding any particular details, I'll be happy to answer them. And our education opportunity will be coming up in mid-April, and just stay tuned to our social media for the announcements as they come out.
Nope, wonderful job by both.
Awesome, we'll keep moving then. I already talked about auditing. Bobby, anything under bylaw?
Sorry, nothing.
Thank you. I'm not aware of any CONs. Executive, I don't think we have much to report there that we won't be covering in other areas. Dave, legislation?
I don't really have anything specific other than for the billing agencies to let you know that at this point, if you're not already aware, the Medicaid crossover and supplement has been left in the governor's budget. That doesn't mean it'll stay, but at this point, it is still in there with the implication that the Department of Budget doesn't want to move it because they know we've been hit hard enough. So that's all I have right now.
Thank you. Carol, anything under membership? Is Carol on? Yep, she's there. Carol, you have to unmute.
Can you hear me now?
We can.
Okay. I don't know. I'm having trouble with my thing here. And there's nothing that I've heard for membership at all.
Okay, Ann looked earlier and we have nobody's terms that are up this year, so we don't have to worry about that for April. Dottie, the nominating committee, our annual meeting is April 5th, and myself as chair and the secretary are up for election. So if you would work with your team, that's Bobby, and I'd have to look to see who it was from St. Lawrence County to see who else is that person, but I'll get that to you as a reminder. So we need to elect chair and secretary at our next meeting, please. Mark Devers, peer committee.
Mark,
I have nothing to report at this time.
Okay, thank you. I'm going to come back to Ann. I would finish out the other committees. Safety. Larry, anything under safety?
I have nothing specific, but I would like to recognize a group that's been doing a yeoman's job in protecting us and keeping us safe for the past year, and that's the dispatchers here. They, they do an awful lot of work behind the lines, and they pass the word to us discreetly and let us know that we do or don't have a problem when we get on a scene. And I've heard that out of St. Lawrence. Or I don't listen to St. Lawrence, but I do listen to Lewis and Jefferson, and it's been excellent. So. Absolutely loving that. I have nothing else unless Bob has something.
I have nothing further.
Mark, REMSCO and CMAC.
All right. So there's some protocol changes that will hit towards the end that are coming out that some of them need some approval on. So really quickly, my report is attached and went out. I will provide the highlights. First off, under education, they are continuing to shore up and improve the testing process. Sometime this year, all original paramedic students will be taking and required to pass the National Registry exam in order to be certified in New York State, and that is for original paramedic students only. Refresher students still have the CME option as well as the state exam option, and other levels have, the state exam is the option or the National Registry at this time. Along with that, all paramedic practical skills exams need to have registry representation at them, so they are pushing for all testing, including retesting, to be done in the same day to meet the registry requirements. The state is doing leadership calls. Currently, they are Thursdays at 4 on a weekly basis. If you do not have the call-in information reach out to Ann, myself, or Jonathan, and we will make sure that we forward that information along to you. Of course, sponsor calls are every other week. They will be starting those up in the near future. Data and informatics is a growing department. It looks like they want to pull more and more data and see the benefit to pulling the data from EMS moving forward. There's some changes to the data requirements, and there's also requirements coming forward that on submission for paper PCRs as well as a e-PCR platform that's available to providers or agencies that fall into certain categories. Ann's going to talk more about that. The new 800 equipment list got approved. That has to go to legal affairs and to the commissioner's office and then come back down to REMSCO for another final approval. And I believe there's also a public comment period on that. So be looking for that, but we're really looking at about a year out. On to some protocol changes. The first one is epistaxis, and they have created a nosebleed protocol, and we'll be adding Afrin to the formulary upon approval. In all of these protocols that I'm going to talk about do require commissioner's approval, and between the CMAC and the collaborative, they will be providing an update to the app as well as training for them. The airway management and oxygenation protocol is going to be updated. They're changing the SpO2 to 92%, and that is to align with the current Heart Association recommendations. Nausea and vomiting protocol, they are allowing a patient to self-administer an alcohol prep pad, to inhale an alcohol prep pad for nausea and vomiting. There's a lot of data on it. It works. The recommendation actually came from a provider in the North Country through the protocol suggestion portal. So people, if you do have stuff, put together, get some research together, and put together a statement. A lot of why this got pushed through was they had data, they had a well-worded statement, and made the collaborative's jobs pretty easy. Excited delirium is going to require, if safe, any patient who's sedated under the excited delirium policy to have waveform capnography, really to assess and continue to assess respiratory status. And finally, TXA, or the hemorrhage protocol, is going to be modified to have TXA for ALS services. There's also a line in there for blood. There's a couple of minor concerns with the wording under the TXA side. REMAC with blood, my assumption is that blood is already regulated through Wadsworth, which manages the state's laboratory licensing. So just because blood is approved in the protocol, chances are before it really makes its way to an ambulance, is going to be there's going to be some form of a regulatory process to go along with that. That's quite extensive. And my final thing that I have is down in the Hudson Valley area, the state has approved, with some minor wording modifications pending commissioner's approval, a pilot program for supraglottic airways and BLS level in cardiac arrest. This is ICE, specifically the iGel device. And Hudson Valley's program agency is willing to manage the data for it and open it up statewide to to get as much data as we possibly can. This is a pilot that I would really encourage local agencies, especially BLS agencies, to participate in and become part of the data submission and process as well, because it really can be beneficial, especially in the rural areas that we have with limited access to ALS. And I apologize, I'm driving, so I think I got anything, and if I missed something big, please chime in, unless anybody has any questions or comments.
So for the supraglottic BLS airway study, I have already let it be known to them that we may have agencies that are interested, so don't bombard them with questions once they have their process together, because again, that still has to be approved by the commissioner and some of the processes developed. It will come to our office and we will certainly shoot it out because we are very supportive of that. So, and the big thing that you'll get to look forward to is when they do finally start printing cards again, they have gotten it approved, so they're going to get new card material that will be durable enough to make it through one and only one wash cycle. So, something to look forward to.
Thank you,
That's all
Mark.
I have. The rest is in the minutes.
Thank you, Mark and Ann. Paul, training and ed.
There's nothing new to report at this time, Deb.
Do you want to give an update on classes that you have going on between Jefferson and St. Lawrence and Lewis?
I could do that now, or I could do it in the county report.
Okay, you can do it under county. Okay, we're gonna go back to Ann now so that she can do the program agency and the REMAC report, please.
Okay, just real quick before I start, and again, my list is a little bit old, but the last one I had with some folks written in. For the nominating committee on the list, I had Dottie Suter as chair, Carol Munch, and Jay Gwinnett on that committee. So Jay is not here tonight, I don't think. I know Carol is, but I didn't know if you wanted who exactly was on that committee.
Bobby, weren't you on it last time? Bobby?
I'm here now. I believe it was Dottie, myself, and the gentleman from Canton. I can't remember his name.
We'll look at that and I'll get something out so that you guys can work on that, please.
Okay. All right. And of course it goes to a different screen, sorry. So at the REMAC meeting tonight, hold on, I'm just getting my screen shared for the program agency report. At the REMAC meeting tonight, some of the approvals that were done by REMAC, new member, Dr. Holliday. He is actually originally from the Oswego area. He was also approved to be Guilfoyle's medical director, and he is now a member of our REMAC. There's some medical director changes that I will cover in my report. As we discussed during the state report, the TXA has been approved regionally. Again, there has to be education and commissioner's approval before that goes anywhere. Or agencies don't need to go out and buy anything for any of these new protocols. Wait for further guidance. And there were 3 agencies approved to do RSI. And a reminder that only providers that have met the provider credentialing process may do so. And there was further discussion surrounding our abilities and opportunities to provide said training in the COVID world. Those agencies were Lewis County Search and Rescue, Guilfoyle, and Governor Rescue. was an update submitted to the 17, and I want to say 07, don't quote me on the policy number, but I think that's what it is for the stroke policy. Again, it falls in line with new AHA recommendations as well as updated New York State protocols regarding the transport of stroke was approved. There was discussion on members who were coming up for expiration of their term, which was Bobby Simpson, Jen Hines, Mark Beavers, and Matt Yelton. So we'll be putting out a request for interest in the REMAC. Again, remember, even though your term is ended, they are open meetings and we really, really want your input. So we would encourage folks to still continue to attend. And again, physicians are the only voting members of the REMAC. So you guys can see my screen okay?
We can.
All right. So we'll look through this. Here are the dates for the new regional, the dates for the regional stroke and trauma advisory committees. They normally meet on the same days at different times. The one in December was canceled, so there's no new information to present to you. Out of the REMAC, we will, I'm sure, be discussing TXA at the next Regional Trauma Advisory Committee as well. And if somebody doesn't get a chance to write those down and they want them, just shoot me an email if you're interested. We have been doing them virtually. So as some of you may have seen, the SUNY Upstate Central New York EMS and our office worked diligently and received funding to create a video for an enhanced ED. The goal of the video is to help providers recognize not necessarily just large vessel occlusions, but posterior strokes that frequently present with vague symptoms. So the education was done. I thought it was a great video. It's less than 6 minutes long, as well as discussion on utilizing an enhanced FAST ED, which looks for dizziness as well. And there is a test that's been created in the online portal that we have. As of last week, 491 providers had taken that test between the two regions. I'm sure that number is higher now. And as of today, I think we had 15 rosters, which, because I got one more today, 6 from the North Country, and we have some more coming from Central New York. So that's the number of rosters. And at the end of this, the first 120 agencies that submit their roster with at least half of their primary providers completing this test will receive a stipend. So, and that was all part of this grant funded money. So it's not a lot, but it's a little bit of money. It'll buy some agencies some PPE, get some folks trained. So hopefully we'll see some more of those rosters coming through. And it also gets our database cleaned up a little bit. So agencies should be notifying us of providers that leave their service or providers that are joining their service as they come in so that we know where they're at. On the stroke front, continuing on, Samaritan Medical Center started sharing information with us. We were able to send feedback out to ambulances who had transported stroke patients into Samaritan. It's just easier for them to send it to us to send out because we have the most current contacts for all the agencies. And we learned that from past experience with Upstate we would send them lists of CQI contacts and then half of them would come back changed. So we also participate in the Upstate Stroke Quality Group. These are the dates, again, all virtual meetings. Yes, I spend my life in virtual meetings. We did have some discussion on bringing in additional representation to this group, and it will be based on agencies who transport stroke patients, a lot of stroke patients to SUNY Upstate. So you may be receiving an invite from them if you are one of those said agencies. New York State narcotic reporting. So back sometime towards the end of last year, in the midst of the pandemic, there was discussion on the agency calls on the new narcotic forms that need to be utilized by agencies. You know, we shared that information, but by the time it came narcotic reporting time, we had all forgotten that information, since it wasn't, you know, in a policy statement or so anyhow, a lot of agencies did not use the right forms. So correspondence has been sent out and for the agencies to use the right form. The form, you know, they went to the Bureau of EMS website. The form that's on the website is the old form. So the new form is on the Bureau of Narcotics website, which is not a site that they routinely visit. So hopefully, whoops, sorry. Hopefully we'll get that all fixed up. We will be putting a link to that Bureau of Narcotics website for now until the Bureau gets it up on their website, on our website. And we've sent that out to everybody. So one of the great things now is we are getting copied on the CON renewals as they are being sent back electronic. This is fantastic because we used to have a hard time keeping our database up to date because we would rely on the agencies to remember to send us back their CON when they received it. So there's a list of renewals that we have done. Again, since I did this last week, we received Messina Rescues in St. Lawrence County today as well. Just a reminder to all the agencies, there is no extension on CON renewals. Your paperwork must be submitted. It should be submitted electronically and in a timely manner. If you have questions, please reach out to Jonathan or I. We have the forms. We continue to remind agencies 2 to 3 months out via a reminder process that we have, and we're sending along all those forms with it as well. The following medical director changes were approved at the REMAC. As I previously mentioned, Dr. Holliday will be overseeing Guilfoyle Ambulance, and Fort Drum EMS went back to Dr. Isaac Mills, and Rensselaer Falls to Dr. Howland. So for notification of public access defibrillation, Antwerp Volunteer Fire Department submitted a new application, and we received an updated application from Salmon Run Mall in Jefferson County. Belleville Volunteer Fire Department was approved for the following regional adjuncts: Narcan, albuterol, and CPAP, and they're in the process of doing the blood glucometry, just didn't quite have the paperwork to us in time for this meeting, so we'll look forward to that coming. So EPCR agencies. So one exciting thing is the REMAX and the REMSCO set forth a few years ago that all transport and ALSFR agencies needed to be electronic by April of 2021. With that being said, we've been working diligently to get everybody going. As many of you know, we're involved in the Coverdale Stroke Project that provided us with an image trend and a regional database with some of our neighboring regions. So we had lots of opportunities for them, as well as our office had negotiated a contract with EMS Charts for all volunteer departments to get a little more cost-effective deal for agencies who were small in volume. With that said, there's the remaining list of folks, which it's exciting that I can fit it on one slide. But what's even more exciting is that Seaway Valley, Cranberry Lake, and Star Lake should be up and running on electronic by the end of February. So we're excited about that. So that really leaves us with 3 transport agencies that will be needing to utilize, well, one's an ALSFR, excuse me, 2 transport, 1 ALSFR that will need to utilize the paper portal at this point, unless they are further along in talks than we are aware of. So we didn't really discuss.
Can I interject real quick, Deb?
Go ahead.
I just one kudos that I think we should really give is to Lewis County, to Bob and Jen for really pushing it there. Lewis County was our first county to be 100% electronic when Turin went in November. So I think that's real kudos to Bob and Jen over there for really leading that charge.
Absolutely. Thank you, guys. So with that said, this is going to kind of lead us into the next discussion because, you know, my initial thought was, well, what are we going to do with these agencies come April 2021? But that was kind of answered today with a correspondence that I received. So as many of you may be aware, a while ago, I reported that as of, and I've forgotten the date, I think it's like January of 2022, all agencies who wanted to continue in the New York State continuing medical education program had to be electronic. And I had a big note up there that said BLS-FR agencies, don't panic. They're going to have an option for you. So the option came forth today in an email that went out to all the agencies. I do believe I shared that with the REMAC and REMSCO as well, so that you'd be familiar with it. So there's a lot of stuff going on, as Mark had alluded to in the state report. So first off is the paper ePCR portal. So historically, agencies have submitted paper PCRs to our office. We count them, record them, send them on to the state. That will no longer happen. The agencies, after their call, they'll come in, they'll enter some data points into image trend system, and then they will scan and upload their PCR directly to the state. So there will be no more mailing PCRs to our office. And we'll work with those few agencies, as you saw on that screen, regarding that. Secondly, in order to be compliant and be in the CME program, there's 2 options. There's a BLSFR portal, which is a simplified portal. If you're a BLSFR, it doesn't have as much information to fill out as a certified agency who transports would have, or an ALSFR. So the BLSFR agencies can get onto for free. And there's a process to go through. They have to fill out a 5136 form, just like any other agency going to electronic PCR. And we will help them through that whole process. If they contact us, we'll be kind of tracking now and getting a hold of all of them moving forward. So there's also a free certified agency or ALS, certified and or a ALSFR agency portal as well. That portal, again, has a few differences with the direct entry from what we offer regionally in the system. So the one big difference is if they utilize the free portal, the data then does not go into Hospital Hub or our regional database. So unfortunately, that may cause fragmentation again of the data. Hopefully, I mean, we're working to try and change that, but in the meantime, it won't go into our regional bridge or into Hospital Hub. So that means agencies utilizing the free portal will still have to send their ePCRs to the hospital via whatever method they agree with the hospital, fax, whatever. Secondly, if there's any additional options, and I have to clarify, but I do believe like the export to billing or any of that, though there would be a fee associated with that. So if there's CAD integration they wanted, the export to billing, anything of being able to use it on the off the internet, the field version, which so that would include potentially downloading ECGs or any data from their monitors. All of that would be at an additional fee on the free portal. But it's just a standard plain Jane PCR portal. And while we could provide them guidance on that, they would have to go through the EMS data support email to, for any changes or anything. But obviously we can, because we're familiar with image trend, we can help with training, etc. So that's the big thing with the PCR portals. There is a schematron, or what the information being required, that is going to change. That has been delayed until April, which is probably good, so it's not all hitting at the same time. This will affect all agencies, irregardless, the schematron change, irregardless of their vendor. We have built some education programs surrounding these changes, so we hope to better communicate with you those than the last time that a schematron change happened. Did I get everything, Jonathan? There's a lot going on in the data world, as Mark said. So we are also working with a bunch of AHECs, Catskill, Hudson Central, Hudson Mohawk, and the Northern AHEC, along with E5 support services. As you know, the last couple of years, we've done an annual leadership conference. We got it done last year before COVID hit, because we did it in February. We're not going to be so lucky this year, so we are working to potentially do a virtual conference around the June timeframe. So stay tuned for more information surrounding that. And EM resource work still continues to move the project forward. Jonathan, do you want to add anything?
So hopefully soon you'll start to see air medical information being integrated. We've had a couple of really good meetings with both Mercy Flight Central and LifeNet of New York to get things started on their ends. And it's now in Javari's hands to get their portals all set up. That's above what Ann and I are allowed to do in the system. We're having bi-monthly meetings with Javari staff to help with engagement and integration to get this moving forward. This week, I'll be sending out emails again to agency leaders to get their third-party vendor software, so their Active 911 or their I'm Responding, Bricks 911 alert addresses, so we can put those in the system, so when a hospital puts itself on diversion or advisory or has some kind of communication that it needs to send out regarding their status, it'll go to the dispatch centers, but it'll also go through the system, so the providers in the field who have their phones on them will know more instantaneous than it going through dispatch and then finally hitting out to their phones. Other than that, we're plugging forward and moving along.
So one thing I'll talk to about the EM resource system is one of the biggest things I hear is how we're in silos, how we don't communicate between entities. You know, we're talking hospitals, 911 centers, EMS agencies. You know, FDR HPO, myself has worked hard on this. Jonathan has worked extra hard on this to bring you a program that, or to bring the region a program at no cost at this point, that really breaks down those silos. And we've had some people that have been, working through it. So we have some hospitals that have been absolutely spectacular. And we are using the data. I looked at it one night when Sarah called me thinking that all the hospitals were on diversion surrounding Samaritan. And everybody had updated it. So it's a great tool. especially during a pandemic, but for emergency management purposes. And this is where I need the REMSCO support to help us get this implemented and get this moving forward. So I guess I'll leave it at that. So feel free to reach out to me. Our opioid prevention program through AMFAR, the contract has been renewed for 1 additional year. It's decreased from 15,000 to 94 for the year, 9,400. And we haven't been paid for the second half of the last contract anyway, so there's 7,500 in arrears as it stands right now. So the good part about this is not the money as much as it is the Narcan that we've been able to get. We have it out there in the hands of the first responders and doing the education, supporting the local law enforcement and fire departments with supplying them with Narcan. So we're hoping that that still continues irregardless. Like I said at the last meeting, we were able to get another shipment of Narcan, so we're still okay. We're about to order again. Hopefully we remain able to get it. So a couple of things. We did have a positive response at the state EMS meetings on a letter that was written regarding the AEMT level. As you know, a while ago, there was a vote made to go to the national curriculum for AEMT in September of last year. That would have been fine, but the national curriculum had not been updated yet, nor have they completed the process at this time. No one expected to have a worldwide pandemic when the date of September 21st, 2020 was set forth. So we had some concerns because, if you were teaching new EMTs not to intubate and follow one protocol, well, their protocol said something different. And what do we do with the current AMTs? Do we tell them they can't do this? There was a couple more medications that it would have taken away from them, or at least one more medication it would have taken away from them had it gone forth before the new national curriculum is actually published. So the state did table any further activity or making that change until the Bureau can, and the collaborative protocols and everybody can get everything updated and education done. So that was very positive. And again, a result of a letter that we sent up there. At the last meeting, one of the discussions we had was with agencies that have reported challenges with purchasing medications due to the Federal Drug Security Act that requires large lot purchases and the expense and waste it was creating for our agencies. I did get a few volunteers to work on a committee out of the REMSCO, and we had a couple meetings. We are lagging a little behind. We're trying to get a survey together, so we need to move on that and get that survey completed and out to our agencies so we fully understand the issue, how many agencies are affected. So I will be following up with that committee again to get that information to move forward with that. But I will say, and I haven't had a chance to meet with the committee, so for my committee members that are on there, I apologize. I just haven't had time to follow up on this. I was kind of waiting for all the information, but I did meet with a representative for PROACT, which is part of Kitties, and they work with all the folks that supply the pharmaceuticals to nursing homes and some other healthcare entities. And we have some lawyers checking and some other folks checking to see if there's any way that they can assist us with the needs for our ambulances. With that said, I have provided them with a bunch of information. They've asked me some other questions that I'm trying to glean the information out of our database, as well as I'll ask to have it added to the survey, some questions, like how much agencies are spending an approximate annual amount on the replacement of medications. So something positive that we're working on. And yes, it is slow, but again, we're working on moving it forward. Course sponsor, I continue to work with Clarkson to set up a course sponsor there. The state is currently not approving new course sponsor applications as they're in the process of updating the manual, but I will tell you right now, I would love to give every one of you a tour of the resources that Clarkson provides to EMS, and this is something that we've never had. The facilities are amazing, right down to the fact that they have a car inside that you can utilize to help teach new EMTs how to move somebody out of the car. They have a fully set up apartment in the lab that you can utilize. They have 2 sim mannequins with a control room that the new EMTs can actually listen to breath sounds. Just the resources are amazing from their PT, OT programs. We'd be able to show them Hoyer lifts and, different ways of transferring and moving patients in nursing homes, because they have all of that equipment there. The classrooms are fully technologically set up, probably even way above my head with some of the equipment that they have. But it's just a spectacular facility, and they really, really want to do this. So I hope that in the near future, you as the REMSCO will be seeing that course application. Right now, we have to wait till the state will send us another one. And at that time, we hope to get it to you guys for approval. But once COVID dies down a little bit, I would welcome anybody to, if they have an opportunity to go see the facilities that they can offer. They are in close proximity to St. Lawrence Health System, so there's a spectacular relationship that can be built there. And in the meantime, a huge thank you to Jefferson County for sponsoring the EMS courses in St. Lawrence County. Whoops, I didn't get rid of my other slide. Any questions for me?
Any questions for Ann before we go on?
Ann, that was an excellent report. Can you come do the reports at State Council for me in the future?
Sure. Are you going to pay my travel?
Are we allowed to travel? You don't even have to go anywhere. It's all virtual now anyway.
We're doing them virtually.
I just wanted to say thank you for the report and getting the messages over, and also see if anybody had any questions on any of the state stuff that I can answer for you.
Well, Ryan, I was going to bring up under new business about the EPCR for our first responders. I was going to look for support from the REMSCO to send a letter in. We understand what is trying to be accomplished here, but we don't feel that by February 28th that's realistic. We have so many of our fire departments that are not even having meetings right now because of COVID. And I just don't think that even if we can get them to have a meeting, that they can commit by February 28th. And I'm very fearful that we're going to lose first responder agencies over this. They're just going to say, that's it, I'm done. And with such a rural area up here, they're vital to the survival of our patients. So I was going to look for support from the council to send a letter saying, we support this, but can we move the date out a couple months just so that we can work with our first responder agencies, give them the support they need, assist them with doing the paperwork to make this a smooth transition so that we don't lose any agencies.
I think it's a reasonable proposal. I think you should put the letter together, and I would address it either to myself and Deputy Chief Brody. But I mean, the goal of this is to work together to get to the final goal. So I'm not overly concerned about that part. We understand that's going to take a little bit of a transition period for us as well, you know, especially when we look at the bandwidth and everything else. You know, one of the first components is really the getting not off paper, but is to, you know, the paper not going into the program agencies anymore. You know, and then the EPCR is kind of a secondary component to it. But yes, if you have a timeline or something that you think would be helpful to your region, I would suggest that you discuss that with Ann and, you know, kind of proceed from there.
Okay, thank you. While Ryan's on, I'm sure he has a lot going on. Does any council members have any questions that they would ask of him while he's here joining us?
Wow, even better.
Okay, we'll go ahead and proceed on then with county reports. Paul Barter, Jefferson County.
Well, as you can imagine, good evening. We've been continuing to be busy. Currently, we have 5 new courses underway, an advanced class with 15 students in it. We have our basic original at the public health, which has got a total of 27 with originals and refreshers. We have a basic class at Clayton at the Tears Ambulance Service with 21 students there. We have a basic ongoing class from the South Jefferson High School students. Those are still ongoing. We have the Clarkson Hall with St. Lawrence County with 28 students, 21 original and 7 refreshers. And we we still have the governor class that is ongoing. They were tentatively going to finish up February 18th, but that was pushed back 1 month, given you know, the issues with the virtual classrooms, the virtual labs. They found themselves a little bit behind, so we pushed it out a month. So they should all finish up by the 18th of March. We did have to cancel our CFR class because we didn't have enrollment enough for that. So as far as the educational side, we're still keeping quite busy. We still anticipate doing a lab instructor updates or possibly a CLI original. But again, it's on hold pending the state approvals. The website continues to be very active. Wanted to talk real briefly about the OD map, which kind of correlates with the opioid incentive. Our reported numbers of overdoses is down. We're not 100% convinced it's because of the decrease of reported overdoses, although with the availability of Narcan, that is definitely a possibility. But thus far in the month of January, or for the month of January, I'm sorry, there was only a total of 12 overdoses, which is significantly down. The Herkimer paramedic program is back up and running. They're going to be restarting lab skills labs at the Bruce Wright Conference Center later on this month. We participated in the Fort Drum tabletop exercise in October. If everybody is not aware, we do have a pandemic going on, and the office is actively involved with the vaccination clinics with public health. We've had vaccinators and post-inoculation monitoring going on in collaborative efforts with the public health service. There is going to be a large scale clinics They're going to begin in the very near future at Jefferson Community College. That is also a collaborative effort with the local hospitals and public health. So there'll be more to come on that. I know there's been reports in the news media about these clinics, but these initial clinics this week are not open. They're already filled, and they were for second dose and some first dose individuals in Group 1A. We're still continuing to do our monthly EMS meetings. I met virtually with the Health and Human Services Committee on January 26th, and they have unanimously agreed to support the initiation of the EMS Advisory Board, and it goes before the full County Board of Legislatures at their February meeting, which is being held tomorrow night. So it looks like our advisory board will come to fruition very shortly. We can get our projects underway. Our county EMS rate reports for the 2020, we had a non-response rate of just 4.05%, which is pretty good considering. And the one thing that I would just like to add is, you know, we talk about the pandemic, and we talk about the safety of our providers. And I know it's been very big topic at the state level, but something just to continue to be mindful of, and that is the well-being of our colleagues. I can tell you just from our monthly reports, I get a daily report from the 911 center on all of our calls, and the suicide call rates in Jefferson County are up 67% since December. So just an important thing to be mindful of your coworkers, your colleagues. And that ends my report. If anybody has any questions, happy to entertain them.
I have something for you, Paul. I've been working with the St. Lawrence County Opioid Task Force and meeting with them routinely. And we've been playing around with the data that we have from our EPCRs to find that the numbers that we were providing them only reported when Narcan was actually given. So we started pulling reports in a different manner, and that substantially increased the number of Narcan administrations that we found, because nowhere were they finding reports when, you know, like a family member had given them Narcan that they had. And in some instances, agencies hadn't documented Narcan given prior to their arrival in a checkbox. They put it in the narrative. So it did take some time to review those, but we can also look at pulling a similar report for Jefferson County for that.
Well, that would be fantastic, because I think you hit the nail right on the head. We see the numbers of dispatches for the poisoning and overdoses, but when you don't see any reports onto the mapping system, you know there's a lot of numbers or a lot of people falling through the cracks. But that would be very useful. Thank you.
Yeah, we looked at cardiac arrest, unresponsives. There were 3 or 4 different primary and or secondary impressions we looked at. And in there, we found either documentation of Narcan given prior to arrival. And I scanned the narratives of these too, and we found where, you know, the patients had it given to them by a family member or bystander that wasn't in there. So a reminder to agencies, there is, even if it's given by a bystander or a family member, that they can document that under medications and hit, yes, it was prior to arrival and who did it. Even if it's an other, we can kind of then trigger us to look into the narrative if we need to. But with that being said, that's the benefit of our regional data bridge, where we now can see the PCRs in Hospital Hub, where we never ever had that opportunity before until we had Hospital Hub through this regional database. I'm done.
Any other questions for Paul? Okay, we will go on to Jonathan for St. Lawrence County, please.
Hello, everybody. For education, I just want to thank Paul and Jefferson County for sponsoring the EMS courses in St. Lawrence County. For the vaccination effort, I'm thankful for the state-run site at SUNY Potsdam. They're vaccinating in mass over there, and it seems to be working fairly smoothly. We also established a county vaccination site located at St. Lawrence University with our public health staff and other nurses and volunteers there, which is running smoothly as well. They're vaccinating 2 days a week at about 150 to 180 a day at the county ran site. In terms of numbers, I released the annual EMS report for St. Lawrence County, which identified a kind of concerning trend of agency turnover and response times. We've increased our turnover rate by 1% from last year, and it's been increasing ever since for the past 5 years, with the exception of 2019. That includes en route to dispatch to on-scene times, as well as agency turnover times. So we're looking at addressing that as well. Our EMD, or emergency medical dispatch program, a while ago they implemented the emerging infectious disease tool, which allowed us to track COVID calls. It flags them if they meet certain criteria. But unfortunately, the program decided to change halfway through their wording on how they add it to the card. So tracking that has been relatively difficult to see how many calls we flagged as COVID calls, and then comparing that to our isolation and quarantine list that public health is provided with. So other than that, that's all I have for St. Lawrence County, unless anybody has any questions about anything.
Any questions for St. Lawrence County?
No, I just wanted to add in to kind of echo Paul's comments, because we've also in St. Lawrence County seen I don't have that in data, but just kind of from personal experience and working in the county, that we've seen an increase in suicide calls as well.
Okay, on to Bob McKenzie for Lewis County, please.
Thank you. Well, first thing I'm going to start with is what John had mentioned earlier about the EPCR, with 100% of our agencies now on board with EPCR. Most of that credit's going to go to Jen. I've fielded some calls about it, and I've turned a lot of them over to Jen. But the real credit goes to the agencies. With as many volunteer agencies as we have in the county, and the agency leaders wanting to take on that responsibility and iron that out, that's really saying something credible about the agencies in the county. Moving on to that annoying, pesky little COVID thing. COVID has been challenging to the volunteer agencies as well, with sometimes only 1 or 2 agencies in service in various parts of the county. Mutual aid and primary calls are being answered, and a lot of it's being done under mutual aid. Day coverage is very limited, and a lot of that has to do with COVID and our increasing number of COVID cases. A lot of times we end up with drivers of these volunteer agencies that are retired, and putting a 70-year-old person in a COVID positive environment isn't always the best idea. So the one agency that's been really knocking it out of the park for us is, of course, Search and Rescue, the largest agency. And they've really done an outstanding job of picking up the slack and making sure that everybody's taken care of in a timely and appropriate manner. We have not had any missed calls or canceled calls due to lacking of ambulances. So we've done fairly well on that side of the house. And I don't expect we'll get there because our COVID numbers are actually coming down. Who knew that after Christmas, we would be #1 per capita in New York State for COVID cases. There's no way anybody could have predicted that. It's just one of those unfortunate sidebars of this world we live in right now. Through all that, we've managed to continue to support all of the EMS agencies with PPE. We were well postured in the beginning of this to support the agencies with PPE, and that was enabled by a group of people that got together prior to me even coming on board. Mark Tuttle was one of those people that was part of a pandemic flu committee that formed, and I believe it was 2008 or 2009. Because of them, we had a stock room that was completely full of N95s and various other types of masks and PPE that enabled us to keep up with the demand that the agencies needed, as well as support the hospital when they got low on their side of the house as well. So kudos to them to be forward thinking. And we have kept those stock levels up, and we're attempting to purchase and maintain that stock as well. And to date, all agencies that have requested PPE we've been able to provide that for them at no cost. So moving on to the opiate overdose tracking, we have assumed those duties as well from the local PD. Our numbers are down as well. I don't have that exact number right here in front of me, unfortunately. It was an oversight on my part, and I apologize. But I do know that our numbers have gone down since we took it on. So just in general, we've been maintaining and tracking through New York Responds and through the Office of Emergency Management. So far to date, we've put 14,000 test kits through the office to support ongoing testing operations, as well as managing donations from civic groups and various businesses, etc. We've delivered masks and sanitizer to school prior to opening. We did that back in August, and that was a very, very successful venture. Last thing I'll say is one of the things that really EMS is involved in some cases is this contact tracing and also isolation and quarantine. Lewis County has been described as what they call a model for counties in supporting the public health office. Office for the Aging, DSS, and even probation and waste management are doing quarantine calls for us, as well as the contact tracing. We have, through the office, orchestrated a lot of the scheduling for that, and so it's kept us pretty busy. I only give you this information because I value the volunteer and the EMS agencies in our county, and I think sometimes I've been a little remiss in keeping up with goings on within these agencies. We're a two-person office, and we're doing the best we can under the circumstances. That's pretty much it for my report. I do appreciate the privilege of being able to do this for the volunteers of our county, as well as all the EMS agencies, hybrid and volunteer. So thank you. That's the end of the report.
Thank you very much, Bob. Does anybody have any questions for Bob for Lewis County? Hearing none, we'll move on. Under reports, John Morrissey is with us. I didn't know, John, if you wanted to say something at this point before we go into old and new business.
Thank you, Debbie. Couple of things quickly. One, please remember, a friendly reminder, I can't stress it enough, please get your renewals for your narcotics and or for renewal of your ambulance service or LSFR services into our office. There are no extensions. We need those in a timely manner. If you do send them to Albany, and please make sure you keep copies and send them trackable, please, because we've had some
issues with them getting lost. And if you want, you can also just scan them and send them down to our office, and we'll process them and we'll send you an email receipt back, or use our fax machine, which will give you an automatic return as well. Couple things just going on. The use as we go down the road for pandemic, the use of EMS workers. There's the training up on Vital Signs Academy for people to go do that. And then if you end up working or volunteering, whatever, at one of these sites, it needs to be an MD or a mid-level practitioner that has to witness and do the state-approved checklist on you, or the MD designates a person who's a CIC or RN or whoever to do that. But you need to be physically skilled, checklist off on that. Something also to share with you that my Binghamton REMAC elected to do, they're doing direct delivery in classroom it's open to all folks for basically what the Vital Signs Academy does. And then they're doing some extra skill work with people in direct delivery with social distance programming. The basic EMTs down there are finding that very useful because they just don't get a chance to do many check and injects, and they find that to be very useful. And I mentioned that if there's an interest in that, I certainly am willing to facilitate what we need to do to make that work. Again, thanks for all your work for COVID, folks. And please reach out if there are any issues. We'll be more than happy to help. End of report. Thank you.
Anybody have any questions for John? John, thank you very much for participating in our calls and giving us feedback and guidance as we've needed it. Hearing nothing else, we'll go on to old business. So the difficult airway contract, obviously, we haven't been able to do anything with that because we haven't been able to have any classes. We're now in discussions about doing a virtual difficult airway course and maybe doing small groups with our people that are the trainers, so that they can get recertified, and we can look at doing some things online and then smaller groups to do the actual skills. This is going to be real important since we've at REMAC tonight approved 3 agencies to start with their RSI. So we really need to see what we can do to get this up and running. Just to make sure that we can support those agencies and the time and money they put into their people to be able to do that. So I'll follow up with Rudy this week and see if we can't firm up some dates with our instructors to make that happen. Does anybody else have any old business before we move on to new business?
Spring fling. I don't think I didn't discuss that. Oh, you got it. Never mind. You got it under new business.
Any other old business? Okay, so let's move on to new business and spring fling. Obviously, I don't think we're going to be having a conference in April at Edgewood. I have spoke with Janine. She is willing to let us move that to the fall. Obviously, her business has suffered tremendously with the COVID and not being able to have conferences and people there, limited when she was doing meals and things like that. But what I would like to get some input from our folks here is, I think we need to look at changing the spring fling in the content of what we do. Ann has done an amazing job over the years growing this conference. But I think there's so much stuff available online now to do lecturing. The lecturing isn't what we need to look at. I really think we need to look at changing it up and maybe having it be more hands-on and learning those type skills. So I'd like people to think about that. And if you have some suggestions, email me so that we can start working on this and looking at what we can do to make it. We need to make it different so that we can get the people there. Again, there's so much available online. We heard tonight from both helicopter services, they're going to be doing virtual training. The state has done a tremendous job with the Vital Signs Academy, and there's things there. EMS 1, everybody's doing stuff to help everybody out. So getting the lecture part isn't really the concern now. I think we need to concentrate on the hands-on And we need to figure out a different way to draw people in to want to come to the conference and participate and do things with us. Is anybody have any input they'd like to say at this point on that?
Deb, I think that's a wonderful suggestion. And I'm going to offer that, I think our providers are, really want the hands-on and looking for the hands-on. And I might suggest, as an example, FDNY does a special operations thing that they've done over the years, which is a combination of like some lecture and then going out and doing physical hands-on. They do things like auto extrication where, everybody's got to come. They're going to do an overview to start, and then they spend a day cutting and chopping and doing all sorts of stuff. So people who don't normally get to do that, do it, and got to work with tools and get to see the other side. They do some things, as an example, with canines and emergency care for canines, and they have vets come in and show how to do certain procedures and things if you have to treat, animals, service animals, because now EMS workers can transport, dogs that get hurt in the line of duty. I'll just offer that, and they've done it over the last couple of years, and it's been very popular, and I think you may have something there. It's just a thought.
Hey, Deb, one thing that I would recommend, unless you rather have these ideas brought back to you in email, would you rather that?
No, I would like an email, but I didn't know if somebody had something that might spawn another thought from somebody type deal,
Well, one of the things I'm thinking of is, especially from some of the drills we've done, would be some form of MCI, start triage, hands-on training. Did I lose?
So please, folks, share some things with us if you've got some suggestions, because that's going to have to be what we look at. And can share with you that we used to be in April and we didn't really have much competition from anybody else, but there's now one that's moved to the beginning of May that really would compete with us if we were to stay in April. Janine doesn't know about rates yet because depending on when we're there, it could be her busy season. So we want to try to do what we can to keep the rates down at the hotel and things like that. But please, if you have some thoughts on what we could do to make some hands-on training, please share that.
Hey, Deb, were you able to hear what I said?
I heard you say MCIs.
Oh, okay. And then I had an issue with my computer. I'm sorry.
That's
I was
okay.
looking at MCI triage programs. After being at that, we did a drill at the airport, and we realized that we've got some issues to take care of. It might be a good idea to do something that way.
Awesome. Great idea. So going on with new business, I would like to, we kind of, Ryan was on the phone, so we kind of discussed that. But I think that we need to send a letter and say, we understand what you want to do with getting all the agencies to EPCRs, but expecting to have a response by February 28th and a transition by March 31st is not realistic. I think it would be realistic to say start the process by March 31st and maybe an implementation by May 1st or something like that, and that would give all the organizations that have first responders in their area a chance to look at things and help them do paperwork, and so that we don't lose these folks. So I'm entertain any thoughts on that.
I agree with you, Deb. I think we need to do something to get that letter in.
Anybody have some thoughts out there?
Debbie, I think we're all pretty much in agreement that needs to happen. Do you need a motion or something for that?
Yes, I do.
Okay, I'll make the motion that we send this letter
So are we
to
going to say that we would like them to, must start the process by March 31st and finish the transition by May 1st? Or does somebody think it should be a different date?
well, even if we could get pushed out even a month further, that would be best because nobody's able to do anything. You can't get a hold of any of these offices anywhere because nobody's working. They're all working from home, but apparently their phones don't work.
So is your motion then that we request that they start the process by March 31st with a completion of May 1st?
Sure.
Deb, I'll
We-
second that.
Lance is seconding that. So we have a motion from Bobby Simpson with a second from Lance Ronas to send a letter to the state requesting that the EPCR program be moved from February 28th start date to March 31st with a finish by May 1st. Jonathan, could you do a roll call vote for me, please?
Yep, hold on 2 seconds.
Thank you.
Yep, no problem. James Barr,
Yes.
Paul Barter,
Yes.
Michael Bennett,
Yes.
Aaron Blackburn,
Yes.
Mark Dalton,
Yes.
Mark Devers,
Yes.
Ken Gardner,
Yes.
Larry Gerard,
Yes.
Rich Hughes, I believe is back. Okay, Rich Hughes, Bob McKenzie,
Yes.
Jonathan Mitchell,
Yes.
Carol Munch,
Yes.
Lance Ronas made the motion or seconded it. Dave Sherman,
Yes.
Bobby Simpson made the motion. Debbie Singleton,
Yes.
Ron Smith,
Yes.
Dottie Suter, she's in the chat. She says yes. Rich is also yes. He's having mic issues. Mark Tuttle, Bruce Wright,
Yes.
Matt Yelton,
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 yeses and 1 no vote.
Thank you very much. We'll get that letter taken care of tomorrow. Get that out to them so that we can hopefully get a little reprieve here and help our agencies so we don't lose any. The next thing on a new business is we need to vote on a new member. His name is Neil Ravenberg, and he is the Jefferson County Office of Emergency Management and Fire, and he oversees dispatch. And if you remember, we've had somebody from that office on before, and Neil is, I don't know if he's paramedic now. He was going to renew his paramedic. I don't know where he's at in that, but he does have EMS background and is looking to join us as the Jefferson County representative from that office. Does anybody have any questions on Neil? Jonathan? Roll call vote.
Helps if I unmute myself. James Barr,
Yes.
Paul Barter,
Yes.
Mike Bennett,
Yes.
Karen Blackburn,
Yes.
Mark Dalton,
Yes.
Mark Devers,
Yes.
Ken Gardner,
Yes.
Larry Gerard,
Yes.
Rich Hughes, see if he pops into the chat.
Yes.
Thank you. Robert McKenzie,
Yes.
Jonathan Mitchell,
Yes.
Carol Munch,
Yes.
Lance Ronas,
Yes.
David Sherman,
Yes.
Bobby Simpson,
Yes.
Debbie Singleton,
Yes.
Ron Smith,
Yes.
Dottie Suter, yes. Mark Tuttle, Bruce Wright,
Yes.
Matt Yelton.
Yes.
20 yeses, 1 no vote recorded.
Thank you. Other new business. Other new business.
This is Ann. I just kind of wanted to reiterate out there to everyone of the funding issues. I'd also like to say it's extremely important for people to get involved in committees and start working on some of these issues. We have a system that's falling down around us. And for some of you guys on the committee, or you haven't stepped up to do a committee project, I think there's a lot of stuff out there that needs to be done, and we need help. And, once you're, within a committee, it's up to that committee chair to, facilitate the communications for that committee. But secondly, I think REMSCOs and program agencies are both in the eye as to whether we're going to be around. And if we're not showing value, I think I will speak for the program agency. We work 101 projects all about at the same time, and we do the best we can on all of them. But for the REMSCO, needs to start doing some of these projects, or we need to, look at the structure. We mentioned this once before, because if the program agency is going to continue to do all the work, I will be putting forth a suggestion to the executive committee to look at moving the funding and restructuring the REMSCO to be able to help us have another person in the office to work on the projects like emergency planning and some of the other stuff that takes a significant amount of time. So I apologize if I've offended anybody, but with this pandemic, we've been really, really, really busy. We've been helping, been tasked, and we're working in kind with no contract. And thank you to FDR HPO for supporting us and keeping us going. Without their support, it would be just the REMSCO.
And
Yes.
I'm sorry, I didn't mean to interrupt you. I'm sorry. To that end, would you be able to, could you or Jonathan send around to all the members the list of committees and who's currently on them? Just another update, get it out to everybody. Maybe somebody's not on a committee and would like to sign up for one.
I will take care of that, Jeff.
Okay, thanks, Deb. Sorry about that. I apologize. Wasn't sure who to address that to, but I think that would be a good thing if we got that out and we could update this.
Well, what we can do is we can take and send out the committees because our annual meeting is in April. we can send out the committees, and I will take the verbiage right out of our bylaws that say what that committee is responsible for. And then we can ask people to indicate what they're interested in. You can see there's a lot of committees there. And we really need to, as Ann said, we need to justify our existence, I guess is the best way to put it. We all hear from the governor about the shortfalls of the budget, and if they see a place that perhaps they can do some cutting and save some money, 25,000 might not sound like a lot, but when you're talking about the number of REMSCOs across the state, that can add up. The same with the program agencies. If we lose our program agency, in my opinion, we lose our services, because I don't think everybody truly appreciates everything that Ann and Jonathan do for us. There's so much stuff behind the scenes, and the phone calls and answering questions. We all know there's a lot of turnover out there in agencies, and people that have no EMS knowledge all of a sudden become the chief and are looking for guidance and direction. And Ann and Jonathan try to provide that, and if they don't have the answers, point them in the right direction and try to do all that. And you know, we used to be part of Central New York, and a lot of us are around and remember what that was like. We were a small fish in a very big pond, and we don't want to see that happen again. We need to look out for our agencies. We've already talked about some of the challenges we're having. So anything we can do to, again, justify our existence and provide what we can to help our services, we need to do.
And Deb, if I might add to that, I was going to bring up a similar thing. I do remember when we were part of Central New York, and us separating off made a big difference. And quite frankly, the North Country EMS has been noted for getting a lot of stuff done. Let's not let that fall behind. Let's stay on top of it.
Absolutely. And, you know, we have some ad hoc committees out there. And I don't even have a list of who is on those. So if you think you're on a committee, you know, also let us know after that list comes out. And again, it may have gotten lost in the shuffle with the pandemic, but.
Well, and maybe what we do is we don't, you know, we just put out the list of committees with the responsibilities, and we realign people where they want to be. And, you know, we ask people to give us their 1, 2, 3. We did that in SurveyMonkey 2 years ago. We can set that up and do that again and get that taken care of. So look for that in the next week or so that we can try to have this in place for our annual meeting in April. I think it's safe to say that our April meeting will probably be another virtual one. I miss not getting together with you folks. I miss doing meals and just having that time to just chat. But hopefully, you know, as our vaccinations continue to increase, we're going to get into a place where we can meet again in person and recognize everybody that's done an outstanding job. And, you know, Larry, you brought up about our dispatchers and that. I think that I probably will maybe try to get a letter out to our dispatch areas and recognize them and thank them. We're so quick to yell at them when they don't do well, or when we think they didn't dispatch us correctly. We probably need to recognize what a vital role they're playing in trying to help keep us safe as well.
I have something else then, going back to the committee thing. Nobody's ever contacted me with any concerns. You know, if the agency has some concerns that the safety committee could address, give me a call, send me an email, whatever. You know, we're appointed to committees, and it sounds like we're supposed to come up with our own topics. If other people have things, tell us what they are, and we can deal with them. You know, I've got a certain amount of imagination, and so does Bob. And I don't know who our third member is right now from St. Lawrence. So we need to deal with, you know, we need to get that piece in there as well. Okay, the REMSCO or the program agency's got 101 projects going on. Can you farm some of them out? Here we are, and we all want to be on the board. So let's get this out.
Yeah, and I think what we can do is once we identify the committee members, we can put out a massive list and put everybody's emails and their phone number so that everybody within the council knows how to get a hold of somebody.
And just, I asked for, volunteers to look at the, potential emergency planning and some of the operations policies and some of that, and the whole group was silent at the last meeting. I did put out a request, I do have another project going. I had 3 people that answered me. So again, I am just, hoping that some folks, you guys are all experts and have been in this field for years, just looking for that support and that initiative to take the ball with some projects, that's trending along with, current trends in EMS or that you're hearing coming out of the state meetings. That's all.
Any other new business? As stated, our next meeting will be April 5th. That will be our annual meeting. If nobody has anything else, I'll take a motion to adjourn the meeting.
I'll make that motion.
Ron Smith makes a, who's seconding it?
Carol.
Carol seconded it. Nobody has anything else, we'll go ahead and let you get off. Thank you, everybody.
Good night,
Thank you.
everyone.
Good night.
Right.